Good afternoon, everyone, and welcome to webinar number 4 in our so far 4-part series, but to be continued, of the Clementine Natural Health webinar series. Our aim here is to create some community online and provide some health education so that we can learn more about our overall health and wellness, as well as bring awareness to some of the unique services we offer here at Clementine. So one of those unique services is IV therapy, and that's what I will be presenting on today. So who am I? I'm Dr. Catherine Multari. I'm a naturopathic doctor here at Clementine, and my focus is on cancer care and general health. I do a lot of IVs in my own practice. It complements well with integrative cancer care, but I also do it for some of my general health patients. I practice full time here and probably have IVs in my schedule daily. So it's definitely something that I feel really benefits my patients and helps both complement and accelerate their treatment plans. So just a disclaimer before we start, the following slides and presentation are intended for educational purposes only and should not be taken as medical advice. Always consult with your medical practitioner before commencing any treatment. So what exactly is IV therapy? Well, when we break it down, IV stands for intravenous, which means into a vein, and therefore IV therapy is treatment that is administered into the vein. So examples of IV therapy that we're very much used to or think of oftentimes happen in the hospital setting. So that may be IV antibiotics or chemotherapy, maybe IV hydration for a dehydration concern, maybe even IV irons for an iron deficiency or an iron deficiency anemia. For the purpose of this lecture, we're going to focus on overall a lesser known or lesser used form of IVs in general, which is IV nutrient therapy, which consists of vitamins, minerals, and more compounds that we'll talk about later. So where did this all start? IV nutrient therapy has actually been around for over 5 decades. It was pioneered by a man named John Myers, who's a medical doctor from Baltimore, Maryland in the US. And although he passed away in the 80s, his wisdom and experience has been passed forward, and we still use nutrient therapy widely across North America and beyond. So John Myers, the pioneer of this therapy, used it to treat various medical concerns. He would use it sometimes monthly, weekly, sometimes even twice weekly for many, many years. And his patients definitely noted benefits, so they would keep coming back. The conditions he commonly treated were things such as fatigue, depression, chest pain, and heart palpitations. It was so effective that people who have used his knowledge and wisdom have broadened the scope in terms of what IV therapy can help with. So the first line there is what John Myers originally used IV therapy for, but now there's been more research in its use in asthma, migraines, chronic fatigue syndrome, muscle spasms, upper respiratory tract infections, so colds and flus, chronic sinusitis, seasonal allergies, and even dysmenorrhea, which is painful periods. So Dr. Myers' presence is still palpable today, as he was the one that invented or now coined the term the Myers cocktail. So you can go to certain places that offer what's known as a Myers cocktail, which is named after the pioneer of IV nutrient therapy, and it describes a relatively basic, straightforward IV infusion. We'll show later on what that would entail. So there's many uses there, and so we would wonder, why would somebody choose an IV therapy to treat fatigue, depression, chest pain, any of those conditions, even colds and flus? Why would somebody use IVs when we can always just take some of these vitamins by mouth? So the purpose of IV therapy and the reason we use it has a few different rationales to it. First, it has immediate bioavailability. So what that means is if we take something by mouth, it will have to pass through our digestive tract and may take a few hours to take effect. Whereas by bloodstream, it's immediately into your blood and it can take full effect right away. Secondly, you have reliable absorption. So if I were to give 5 different patients 1 gram of vitamin C, it's hard for me to know how much they truly absorb. One patient may absorb 20% of that and only get 200 milligrams, sorry. Another patient might absorb 80% and get 800 milligrams of vitamin C. It's really hard for me to tell because each person's physiology, especially when it comes to the digestive tract, is very unique. However, when I give patients, say I give 5 patients each 5 grams of vitamin C by intravenous route, then I know all 5 of them have like the exact dose that was administered and used physiologically for those patients. So it's a lot more reliable when it comes to dose. And lastly, on dose, you can achieve a much higher dose and higher concentration. So we are limited when we use our digestive tract. We can only absorb so much, and many digestive side effects are going to happen. So if you take more than 5 grams of vitamin C at once orally, you will likely have loose stools. We can titrate vitamin C much higher than 5 grams by IV and have no loose stools. So you have much higher doses available, and a lot of nutrients behave very different at low and high doses. So you can achieve very different, very useful effects of vitamins through IV administration. The cons is that it's a more invasive procedure. It also requires the patient to take the time to come into the clinic, and it can be more expensive than oral supplementation. Okay, so we now understand what conditions we use it for, and we also understand why we would use IV therapy over oral. So this seems great. Is IV therapy for everyone? Unfortunately not. It is for most people, but the doctor will do a good job reviewing any recent blood work, doing a physical exam, and also doing a health history to make sure that IV therapy is safe for you. These will all be safety is our first priority, and all of these considerations will be thoroughly assessed by your doctor. We also want to make sure, if we think of some of the indications, for instance, if fatigue is a concern, if we're giving IV B vitamins, vitamin C, it might not be a B vitamin or vitamin C deficiency creating the fatigue. So those might not really benefit the person's energy. If the person has an undiagnosed iron deficiency, for instance. So it's the doctor's role to first make sure it is safe by using these 3 screening tools, but secondly, doing a thorough review to make sure there's not another underlying cause that we're ignoring. We want to really make sure we understand first why you're feeling the way you are and how IV therapy can benefit you. So now, who is it for? There's many people that can greatly benefit from IV therapy. That includes older individuals. As we mentioned, digestion is a big barrier to oral supplementation, and our absorption decreases as we age. People with other absorption challenges include patients with irritable bowel disease, such as Crohn's or colitis, patients with celiac disease, those who have low nutrient status. So maybe those people with absorption challenges will therefore have low nutrient status, can really benefit from extra nutrients delivered directly into the bloodstream. And those who are chronically ill, so maybe they're dealing with a chronic viral infection. So whether you're dealing with a chronic viral infection or post-viral infection and post-viral illness, IV therapy can be a great adjunct to get your system back up to baseline. Metabolism requires a lot of these vitamins. Detox requires a lot of these nutrients. So the bloodstream can be the most effective way to get those systems going. Adrenal support, I put that in there, but more so neurotransmitter support. Neurotransmitters are those chemicals that signal throughout our body, and cofactors for a lot of those chemicals are B vitamins, vitamin C, magnesium. So we really need to make sure that we have high availability of those vitamins and minerals and nutrients in our bloodstream so that we can have proper cellular functioning and communication throughout the entire body. Lastly, I put aesthetics in there as well. For a lot of my patients, this ends up being not necessarily the primary reason they're coming to see me, but an added benefit. They may notice that after a few vitamin C infusions or glutathione infusions that their skin is more even in texture, which makes a lot of sense when we think of the vitamin C even, the wound healing and collagen production activities that vitamin C can really help with. And once again, we're getting that vitamin C at much higher dose than we would be able to achieve orally. So what else? So we talked about the Myers cocktail. Next, I want to talk about what exactly is in the Myers cocktail and what else can we use through IV therapy. So the Myers cocktail is the first 5 nutrients on this list. So Myers cocktail consists of vitamin C, magnesium, calcium, B complex, a few B vitamins. Other things we can include, so the Myers is kind of our baseline, and then since John Myers kind of created his baseline formula, we've then expanded upon that and seen other additional benefits we can achieve through adding zinc, selenium, trace minerals, and so on into the IVs, either added or solo as a monotherapy. So we know zinc, selenium, trace minerals can be very helpful for the immune system. Amino acids can be really quite helpful for a variety of conditions, depending on what amino acid we're using. So we might use something like L-theanine for some nervous system support, or we might use something like L-carnitine to help preserve muscle mass in a muscle wasting case. Glutathione is great for detoxification. NAD is great for cellular health and aging, and sodium bicarbonate if we need to create a more alkaline formula. So to note, one thing I think is really important to consider is that every IV we compound individually. So we do not use stock formulas. We take a look at the patient case, the patient blood work, and we make the IV very specific to your individual needs. So the exact formula of dosages of each nutrient will be different for every single patient. The treatment is individualized and does vary from person to person. And I should mention as well, this is kind of a list of the basics we offer in IV therapy. However, there's a lot more advanced IVs that I will use in, for instance, cancer care. We'll use high dose vitamin C and a few other agents. Mistletoe might do IV chelation for the case of heavy metals. So those are all for additional indications and a little bit more advanced for another lecture. So putting this all together, IV therapy is one of those tools that is offered here at Clementine that can really assist in getting your health to the next level and can really assist with accelerating your treatment plan. We do create individualized treatment plans to suit your needs. We offer these to both new and existing patients. So if you're an existing patient here, feel free to talk to your doctor about if this might be right for you, if you're interested. For any new patients, we do offer initial IV therapy visits where we'll do the physical exam and look at your blood work and make sure it's safe to proceed with the IVs, and then we offer return visits for any subsequent therapies. So just wrapping up, a quick summary on what we talked about today. IV nutrient therapy has been around for over 50 years, so it's something that's quite well established, and we've kind of expanded on its original use to suit today's needs. Higher doses of vitamins, minerals, nutrients are achieved through IV administration, higher doses than what you can achieve by mouth and orally. many people and conditions can benefit from IV nutrient therapy. And that IV therapy at Clementine here is formulated for the individual. So I hope that this lecture has been informative for you all. If you do have any other questions specific to this lecture, you can let us know. If you have any questions specific to me, you can also let us know at hello@clementineclinic.com. And if you have any ideas for any future webinars, please let us know, and I'd be happy to expand on any of the points I touched on today in a future webinar. Thank you and have a great day.